your body is essentially the sum record of your challenges and your opportunities. And often those are arrayed across space in neighborhoods. So too many Americans live in neighborhoods that have too few opportunities and too many challenges. And because of that, they're aging faster, they're developing chronic disease more often and earlier, and it's shortening their lifespans. This idea that in this social impact bond, which is so creative, the one thing that sort of to keep in mind is that one special education slot is as expensive as a whole kindergarten class. So this is why my motto lately is that the status quo is stupid and expensive. And that's why, we spend money on the wrong things, whether it's special ed for kids who don't have cognitive disability. It's just that they didn't have the enriched environment to grow up in that middle class kids have. Similarly, you have situations where, we have a whole system in place to pay for chronic disease once it happens, but we don't yet have an ability to pay for a system to pay for preventing chronic disease before it happens, and this is why the social impact bond work that Goldman Sachs is doing is so important.
I think one of the issues is that financial returns are really easy to measure, it's clear dollars,
right.
But how do you measure the social return, and how do you make sure that the dollars that are being invested in an effective way to make sure that you're getting the outcomes that you want?
Sure, that's a great question. But I want to go back to something you said earlier, though, about this why focus on health and not education or some of these other issues. And I just want to reemphasize the point that sort of health kind of summarizes all of those other things. So you might not think about it, but it might not come to mind just immediately, but the best predictor for future health for an adult, for a third grader, is whether or not they're reading at grade level. Right? So there's a lot of these things that are linked in ways that are very hard to they're counterintuitive at some level. So we find that the work that we do in community development, which is an industry that about $150 billion a year invested into low-income communities, very effective in what we do. It builds service-enriched affordable housing, as Susan was mentioning, in downtown Los Angeles. We have projects like 3 million of those homes all across the country. We build grocery stores and food deserts, charter schools that do great work for niche populations, and federally qualified health centers, other things like that. And we're big, but we're not big enough. And the medical care system, as they shift to this from pay for procedure to managing population health, they're big, but they're not big enough. And so we need to start aligning all of these different sectors together with the education sector and the public safety sector and all these others, so that we're all working in the same direction to turn those neighborhoods around, to make them places that promote health rather than detract from it. And so that's something that's really a challenge. Now, how do you know you're making a difference? That's really hard. We do have some measures. We do have, there are some places with very sophisticated dashboards with, is there maternal depression in your family? Do you have access to a job? Do you feel like you're supported in some way? We can do polls and we can do surveys, and we have a number of different ways to do this, but it is really difficult to sort of get the measurement right, to be able to monetize it in the way that the pay-for-performance vehicles really necessitate. And so we're really just at the front edge of figuring that out.
We just mentioned sort of broadening the universe of potential investors into the sector.
Yeah.
Can you talk a little bit about the efforts to connect with maybe some of those hedge funds or other folks
Sure.
who might move into the space rather than the banking sector?
So
in addition to the
banking sector.
Well,
additive, not subtractive.
So Goldman Sachs was the pioneer in the social impact bond, but now all of the banks are issuing them, all the big banks, that is. And a really interesting milestone was just hit recently, where the first social impact bond in the state of New York, focusing on housing people who are high users of the medical care system in supportive housing, was not marketed through their CRA operation, but through their high net worth individuals, were the investors. So you're starting to see there's a huge demand among what are called socially motivated investors or impact investors. They're really desperate to get into this space. It's relatively easy to invest into sort of the developing world or in environmental issues, but it's harder to invest in anti-poverty work in the United States. We're trying to come up with new vehicles to make that easier for them. We think there's a tremendous potential with that investor group.